Welcome to Women of Resistance. On this show, we amplify the voices of women living in incredible circumstances, voices that are often sidelined and misrepresented. This week, we feature a 17-year-old Farha Kamal Abu Ghaban from Gaza. Here is her story.
What a difference a year makes.
أبوي اليوم مشى على الحادث والمستشفى.
Meet Farha, a young woman whose way of life and very existence has been transformed by the Israeli genocide that has rocked Gaza and has now spread to the West Bank and Lebanon. We caught up with her from the fourth location her family had been forced to flee to and reflect on how her life has changed.
أنا فرح كمال أبو غبن، عمري 17 سنة، نازحة من شمال غزة إلى جنوب غزة في مواصل خان يونس. لي 3 خوات وأخ واحد، كمال عمره 10 سنين وسدل عمرها 10 سنين 11 سنة ووتين عمرها سنة ومسك 5 سنين.
One of the most difficult aspects of the unspeakable horrors committed has been the moving of families, their displacement, including Farah's, from one location to another as the bombs rained down.
كنا سكان الشيخ رضوان، نزحنا سادس يوم الحرب بسبب طبعاً أجتنا مناشير إخلاء بإخلاء المنطقة. طلعنا من قطاع غزة سادس يوم الحرب، نزحنا لمنطقة تل السلطان في رفح، أجت مناشير لتل السلطان بالإخلاء، نزحنا من تل السلطان لمواصي رفح، برضو في مواصي رفح أجتنا مناشير إخلاء، نزحنا إلى مستشفى الأوروبي. مستشفى الأوروبي صارت إصابة أختي، فالوضع صار كتير خطير، بدأوا في قصف المستشفى. حاولنا نطلع من المستشفى كانت الظروف الصحية صعبة لماما وأختي، بس رغم الظروف أجبرتنا إنه فيش شيء، كل الناس كل الطاقم الصحي طلع، فطلعنا هين لمواصل خان يونس. في خيمة في وضع صحي كتير صعب بالنسبة للمصابين اللي معنا. طبعاً النزوح إشي كتير صعب، إنك تجمع كل أغراضك في شنطة واحدة طبعاً بدون وسيلة مواصلات. أنت مضطر تحط كل أغراضك في شنطة واحدة، وطبعاً ما تاخدش إشي معك. النزوح مع أطفال كتير صعب، إنه الطفل يمشي لمدة كتير طويلة مشان على الأقدام وحامل شنطة على كتفه، فهذا إشي كتير ما حد بتخيله إلا اللي جربه، اللي هو النزوح من مكان لتاني مشان على الأقدام، مع القصف، مع الكوادكوبتر بتطخ عليك، مع إنك ممكن تستشهد بأي لحظة من الزنانة اللي بترمي صواريخ. هذا إشي كتير صعب في النزوح. طبعاً تروح للمنطقة اللي أنت متواجد فيها، لا معك خيمة ولا معك أي إشي من الظروف اللي أنت قادر تخش فيها، لا حرام ولا بطانية ولا أي إشي، بس أنت نزحت معك شنطتك، حتى مش عارف وين تروح، تكون تايه ماشي بس حامل شنطتك وتايه مش عارف وين تروح، فهذا شعور كتير صعب.
Like most Gazans, Farah's family has been directly impacted by the ongoing violence. Despite the injuries suffered by both her mother and the family's youngest member, a baby girl who has only ever known this genocide, Farha goes on to explain their pain, but also the trauma of other Palestinians.
من نزوحنا لغزة لمستشفى الأوروبي اللي هي إصابة ماما وأختي. كان وقتها القصف كتير في المستشفى، إحنا نازحين كنا في قلب المستشفى، أختي انولدت في الحرب. فكان القصف في ساحة مستشفى الأوروبي، فأدى القصف هذا لحروق من الدرجة الرابعة في إيد أختي، في إيد ماما وظهر أختي ووجهها بالكامل انحرقت. كان المستلزمات الطبية ممنوع تفوت، فكانت الوضع جدا سيء. حروقها كانت البنت سايحة حرفيا. فالصليب الأحمر رفض إنه يعالجها لحد ما إيد ماما خضرت، وحتى كانت قابلة إنهم يقطعوها بعيد الشر. فحاولت تجيب بعض الأدوية ولحد الآن بتتعالج، غير العمليات اللي انعملت لها الطفلة. يعني الطفلة هاي انولدت في الحرب، ما عاشتش أي شيء من طفولتها غير إنه بس انولدت وانحرقت وصحيت على صوت القصف، ووضعها الصحي جدا سيء. بعد تجربة أختي وأمي إحنا كنا نازحين في المستشفى. طبعاً غير مشاهد الشهداء، أشلاء الأطفال، القصف والدم، فقدان الأحباب، إنه نشوفهم في أكفان، كان من أكثر المواقف الصادمة في الإبادة الجماعية. غير أصوات القصف المستمرة 24 ساعة، أحزمة نارية، صوت طيران، صوت إطلاق نار، كله هذا من أسوأ المواقف في الإبادة الجماعية اللي إحنا بنمر فيها.
Like tens of thousands of her peers, Farha had dreams of continuing life as a high-achieving student before the genocide sadly intervened.
أنا كنت أدرس في مدرسة زهرة المدائن شمال قطاع غزة، طالبة ثانوية عامة، لكن الآن لا في ثانوية عامة ولا في شيء، المنطقة مسحت بالكامل، ما فيش أي مدرسة نقدر نرجع لها، فيش أي مواد تعليمية ممكن نقدر نرجع لها، وحرفياً التعليم بدأ صفر. فيش إشي، يعني كل حياة الإنسان الجامعية أو المدرسية كلها انمحت عن الوجود. طبعاً الحياة كطالب صعبة. طالب إحنا في غزة مش زي أي طالب في العالم، مش متوفر له كل حقوقه، إنه يدرس يتعلم، أجهزة التقنيات الحديثة هاي كلها كان محروم منها الطالب. طبعاً حياتي المدرسية كانت نوعاً ما جيدة، كان في مدرسة، في أدوات مدرسية، في شوية من حقوقنا، لكن الآن إذا كان في شوية الآن طبعاً محيت بالكامل، لا في مدارس ولا في شيء. حياة الخيم صعبة جداً، وصعب إنه ننشئ مدرسة جوا خيمة بسبب الظروف، لأنه الخيمة لا بتقي لا من شمس ولا من شتاء ولا أي شيء، ولا في أي مستلزمات طبعاً، لا خيم مناح ولا شوادر ولا خشب. كل شيء هذا محروم منه الطالب أو الإنسان الغزاوي بشكل عام.
As the genocide rages on, the thoughts of what comes next is overwhelming, especially when death and destruction have been constant companions for well over a year. Farha and her family have pressing concerns and grave worries for the health of mom and their baby sister, who has already endured a staggering 23 separate procedures for the burns she endured after the Israeli munition strike destroyed the family tent.
رسالتي للعالم إنه أنا بس محتاجة أسفر أمي وأختي للعلاج. حالتهم الصحية كتير صعبة، مش متوفر الأدوية. حاولوا نروح أطباء بلا حدود، عناصر بحكي لك فيش أدوية. فهذه كلها حالات مستعجلة، مفروض تفتح المعبر وإنه يطلعوا هدول يسافروا. يعني طفلة انولدت في الحرب، انولدت وهي محروقة، كل عصبها رايح، ما بتقدر تتحرك حتى الأم. يعني ماما ما بتقدر تمارس حياتها كإنسانة طبيعية.
Word of the solidarity being shown globally have filtered through to the Palestinians like Farha, who are living under a live-streamed genocide.
العالم تقريبا مش كله متضامن معنا، في بعض الدول الأوروبية متضامنة، يعني كبيرها تطلع مظاهرات تنشر بوست عنا تحكي عنا، بس حرفيا مش الكل متضامن معنا، مش كل صوتنا واصل، مش كل الناس بتعرف احنا بايش بنمر حرفيا. ما برأيي يعني مش كثير الناس متضامنة معنا من خارج القطاع، مش كل حياتنا بالتفاصيل بتعرفها، شو المعاناة اللي حرفيا احنا بنمر فيها مش كله بيعرفوا الناس. بس المظاهرات ممكن تكون تضامن معنا، انه الواحد يطلع ويحكي ممكن تكون تضامن معنا، بس مش كل حياتنا معروفة بالتفاصيل عند ردود العالم خارج قطاع غزة.
Despite the failed promises and officials who continue to put partisan politics ahead of human rights, Farha has a message for them and everyone else.
رسالتي للعالم إنه يستمروا في التكلم عنا، تكلم وانشر، احكي عنا شو بصير. احنا بالنسبة لنا محاصرين هين، يعني ما بنقدرش كل فيديوهاتنا نطلعها، ما بنقدرش نجسد معاناتنا بفيديو واحد. فأنت الدور عليك إنك أنت تحكي، تنشر، تناشد الناس. في أطفال مرضى هن محتاجين السفر، يعني أختي من أحد الأطفال المحتاجة السفر بوقت كتير عاجل بسبب إنها محتاجة كتير عمليات، عملت 23 عملية ومحتاجة أكتر وزراعة جلد. يناشدوا العالم ضلكوا احكوا أي إشي اعملوا لنا إياه، إنه توقف الحرب، يفتح المعبر للأطفال تسافر، دخلوا مساعدات. كل هذا مفروض العالم تسعى له إنهم يعملوه. من المهم لأنه إحنا بنعيش المعاناة ومحدش بيعيشها غيرنا، فمن المهم إنه الناس تعرف صوتنا عشان هي تكون تتكلم عنا، تتكلم عن الأطفال، عن المجازر اللي بتصير، عن الإبادة الجماعية، عن قصف الناس، قصف المدنيين، الأطفال الأشلاء، الأطفال المحتاجين علاج. كل هدول مفروض الناس تتكلم عنهم. إحنا صوتنا مش قادر يوصل لخارج قطاع غزة، فأنت كإنسان أو عندك إنسانية مفروض تتكلم عنا، توصل صوتك لكل الناس. في ناس كتير بتعرفش إيش بتصير معنا، في ناس كتير يعني مش عارفة إيش غزة، إيش بتصير، هل عندكم حرب؟ إحنا عندنا حرب. اتكلم، انشر، احكي، افتحوا المعبر، دخلوا مساعدات، نكون إيد واحدة على القليلة إنه يفوت أكل. الشمال في مجاعة، الشمال تحت الإبادة، هاشتاجات هاي المفروض كلها تنتشر حوالين العالم، كل الناس تعرف فيها. فأنت صوتك كتير مهم. في ناس بتحكي أنا بقدرش أعمل إشي، لا بتقدر على القليلة، احكي، انشر، تكلم. هذه كلها من الوسائل إنه الناس تعرف إيش بتصير معنا.
The genocide has already cost Farha and her family way more than they can ever pay. Robbed of her youth and any future plans, at least for the foreseeable, buried with Gaza's rubble, what more can be taken from Farha and those she holds dear?
To discuss Farha's plight, I'm joined in the studio by a medical doctor based here in London, Dr. Sukaina Hirji. Welcome, Dr. Hirji.
Thank you.
17-year-old Farha, absolutely heartbreaking to hear her story. Your initial thoughts as you watched her video?
I think the first thing that sort of springs to my mind is, she shows so much resilience and steadfastness. She is a 17-year-old girl. And when I think about 17-year-old girls, they're, at the prime of their life. They're looking to see which career they want to do. They'll be socializing with their friends. They've got so much going for them. But I guess like the other 2 million people in Gaza, she has to be a pillar of strength for her family. She has to care for her mum, who's been injured so badly, as well as caring for her baby sister. As well as dealing with the starvation, the lack of access to medical care, all the death and destruction around. So it's a very, very difficult situation to imagine.
It's almost a privilege, I think, when we think of our 17-year-olds, because, they don't have to go through such challenging times. And
Yes.
you grow up earlier when, there is adversity.
Right.
But in the process, they lose out their sort of a childhood, their early adulthood, isn't it?
That's right, yeah.
Now, we've been also watching, these images for the past, more than a year now. And of course, we cannot compare the trauma they are going through.
Yes.
But, a lot of people are also talking about the effect it has had on us.
Yes.
I know that I'm a completely changed person in this 1 year. And, it's very hard to really detach, how do you think this is affecting a lot of people who probably we haven't, it's a mass issue that, how do you think it will project itself as a person coming from a health background?
I think trauma overload is the correct term to use. It is so traumatizing to watch these scenes live streamed to our phones on a daily basis. I mean, every time we think it can't get worse than this, it gets worse. Seeing people burned alive, seeing people killed, seeing children, so many amputees that are children. And then on top of that, seeing the fact that they have lost their shelters, they've lost their loved ones, they've lost their jobs, they've lost all hope of a future. I think it's very difficult to see. But I think one of the things that I really admire in the Palestinian people is how much hope they have, even in what I see as a completely hopeless situation. They still run classes for children. They're trying to teach the children. They're trying to grow crops. They're still doing almost like cooking videos as well.
Yes.
And I just think, even in their darkest hour, they can still see hope, and they're still trying to preserve what small part of life they have left. They're still trying to preserve that. So I think I take a great lesson from that, because for us to see it is absolutely terrible, and we feel very hopeless. But looking at them, I think they show us how to have hope.
Absolutely. But then, when you talk about hope, there's a little more hope for some than others. And when we talk of Farha in particular, there's a baby she's talking about who's had 23 surgeries.
Yes.
In terms of medical terms, what does that mean? The kind of treatment needed, what obstacles might be there in the situation they're in?
Well, I think just to add a bit more background to this, I want to just talk about the situation in the occupied territory, so Gaza and the West Bank, before the genocide started in 2023. So in 2021, there was a study done by a research burns institute based here in the UK, in Swansea. And they were looking at the prevalence or the incidence of burns, serious burns that happen in Gaza and the West Bank. And they found it affected about 1.5% of the population. But if you compare that with the entire region, so in that region, it's called the Eastern Mediterranean region, there's 21 countries. The rates of serious burns across the whole region is only 0.001875%. So the rates of burns in Gaza and the West Bank were already 1,000 times more before the genocide started. So now it must be massively more, because we see it every day. So in terms of burns, treating burns is very, very complex, and it requires a lot of immediate access to treatment. So I think the challenges that the people in Gaza face are, first of all, even trying to get access to the treatment. For them to get from wherever they are to a hospital is very challenging. There's no ambulances, or ambulances are attacked when they try and collect wounded people. And even if they get to the hospital, most of the hospitals there are hardly functioning. I think there's 37 hospitals in Gaza, or 37 healthcare facilities, and they're barely functioning as it is. Most of them are being used as shelters, so the sanitary conditions are very poor. So to look after a burn, you need to first make sure that infection is prevented. You've got to make sure the patient gets enough fluid so they're not dehydrated. So they don't really have access to antibiotics, to fluids, and then they need to have repeated surgeries to prevent scar tissue. So I fear that Farah's youngest sibling is going to be having surgery for the rest of her life, because every time she grows, she'll need more surgery to prevent further scar tissue forming. So it's going to be very difficult and very challenging for them as a family.
Absolutely heartbreaking. Let's come back to that discussion in a minute. Just reminding our viewers that we are talking about women of resistance, and today we are discussing the story of 17-year-old Farha Kamal Abu Ghaban from Gaza. Dr. Sukaina, so in terms of even survival rates for like the baby or even the mother, her hand is burnt,
Yes.
and this may result in a disability, I believe.
Yes.
What are the chances that they might just make it or not make it?
I think it seems that their chances are probably going to be quite difficult in Gaza, because every time they go for a surgery, will they have access to anaesthetic? Will they be operated in a clean environment? I mean, we know that surgeons currently in Gaza have to use, washing up liquid and vinegar to sterilize before they operate. So how are they going to prevent infection? So I think their risk of infection and death is probably significantly higher than if they were not in that situation.
Of course, all along that, there's drones going on. They might get bombed any minute. We don't know any of that happening. But also, I mean, overall, if you look at the wider picture, in the medical, world, what kind of real discussions are going on in terms of helping, the assistance that can be sent, or just other concerns around the health sector in Gaza?
Yeah, there are a lot of concerns because there are many healthcare professionals from the UK who are going to Gaza and have gone to Gaza to help out with the situation there. So there is, amongst healthcare workers, a very huge understanding and a very massive empathy for the healthcare workers in Gaza. We all really mourn the loss of more than 1,000 healthcare workers. And we cannot imagine the circumstances that they work in. I mean, to have to operate on people without anesthesia, to not have access to dressings or antibiotics. And as a GP myself, I think one of the biggest things that hits me is that in my role at work, I'm there helping people manage their own chronic illnesses like high blood pressure, diabetes, arthritis. But there's absolutely no way of doing that in Gaza at the moment. So people who are diabetic or high blood pressure, they're not getting their treatment. So their risk of heart attacks and strokes is massive. Their risk of kidney damage, of losing their sight from diabetes is huge. So there's the one aspect of managing the acute, the wounds and the injuries from all the destruction. But then there's the chronic health, which is completely put on hold as well. Absolutely. So I guess their risk of death is high from so many different things.
Now, as a healthcare professional yourself, you're a doctor, and you've just explained, what you do in your surgery. Is it something that keeps you awake at night? I mean, when you are treating your patients, you've been watching this for 1 year. We see continuous bombardment of this hospital. I mean, they've bombed everything, and they keep on and on. Yeah. How has it personally affected you?
Not a day goes by when I go into work and I don't think about, and I guess I don't appreciate and I don't value the security that we have here, because to operate or to work in a situation where there's no security, it's unimaginable, Particularly there's two doctors that, their stories really hit me. So there's an orthopedic surgeon, Dr. Adnan Al-Bursh. He actually was in the UK at King's College Hospital. He did his training here. And he worked really hard to try and save as many lives from the beginning. And he was forced to evacuate from his hospital. So he went to another hospital to try and help there, but he was actually abducted, then put in prison, tortured, he was raped. And then as a result of everything that happened, he died. But this was reported in the mainstream media here because all he did was try to help his patients, and this is how he was punished. And just 4 days ago, there was another orthopedic surgeon, Dr. Saeed Jude, and he'd already been injured last month from shrapnel because I think there was a drone that had been attacking in the area. He was in an ambulance going to get medical supplies, and he was executed during that. So as healthcare professionals, it really hits us hard to see our colleagues being treated and not granted the sanctuary they deserve.
I mean, we have to salute all those people working in such difficult conditions. Thank you so much, my very special guest, Dr. Sukaina Hirji, and thank you for watching. Until next time, we will leave you with the Palestinian sounds of the artist, Safe. Goodbye.